My guests today are Jay Schnitzer, the Vice President and Chief Technology and Medical Officer at MITRE, and Sandra Beatty, the first Deputy Director for Budget for the State of New York. Jay, Sandra, thank you for taking the time to join us.
Thank you.
This is actually part two of our conversation around vaccine credentials. In part one, we heard from Dr. Schnitzer, as well as Tim Pados, the Vice President General Manager of Government at IBM, and JP Pollock, the founder and Chief Architect of the Commons Project. For this discussion, we're going to dig a little deeper. We're going to talk at the state level, someone who's actually using the credential, actually putting this into practice. And we're going to talk about it from a policy perspective, a technology perspective, and of course, most importantly, a societal perspective about how to get broad adoption of the vaccine credential. Sandra, let me start with you because New York's ahead of a lot of other states around the country. Let's discuss the application of your vaccine credential, how it works, some planning behind us. Just give us some overall views of where we're at today.
Sure. First, thank you all for having me, and we're excited to talk about this. As you indicated, New York is first in the nation with the Excelsior pass and the health credential. It started off as Governor Cuomo's vision in January when we were in the height of COVID and COVID response within the state of New York. And it was a forward-looking vision relative to where will we be at when we get through to the other side, and how will we safely and securely reopen the New York State economy for all of our residents and our businesses alike. So that's really where our vision first started. It's an exciting chapter in New York State, particularly from a digital platform perspective. We've never had such a digital credential perspective in any of our other policy areas. So this is the first. And we're excited. At this point, it's about, making government work and work for the people, and also having the individuals have an equity, safe, and secure avenue to be responsive to showing their vaccination status, either as optionally, as some industries are now requiring it, which is not part of the New York State reopening guidance, but there are areas where we do require either the CDC card or the Excelsior pass, particularly if you're attending major events. It's just completely voluntary and free. That's always been the foundation of what we were doing here, is that it would be voluntary and free to all to the individuals and all to businesses. And that's really been a hallmark throughout this journey.
You mentioned a couple of things that I'll follow back up with. You mentioned equity, you mentioned secure. So we're going to hit upon all those topics later on. But let me start at the beginning. When someone came up with this idea, or the group of you came up with the idea that said, what if we did a vaccine credential? What did that look like? How did that discussion happen? Walk me through a little bit of the thought process, because in some ways there's a lot of, if you will, perception challenges that come with it.
Yeah, so, in January, this really started with a vision that was a paragraph long in the Governor's State of the State book. But you talk about a vision, and a vision doesn't have to be many sentences. It can be much more complexity and layered to actually put an idea into fruition. And this was very much a public-private partnership. When we started down this journey, we really were interviewing and speaking to industry leaders in the private sector in this space for digital identification. And through that process, that is how we entered into our partnership with IBM with the blockchain technology they provided.
Jay, jump in, because as you heard Sandra talk about the private sector partnership, and in the previous conversation we had with the folks from IBM and the Commons Project and yourself, we talked a lot about that. This in many ways is being driven by states like New York, but also the private sector. Walk me through the importance of that relationship between states like New York and the private sector.
Thanks, Jason. And by the way, it's great to be with you again. And thank you for including me in this conversation. So first of all, I'd just like to say, I am thrilled that New York State took the lead on this, and they really kind of plowed the way for many others to follow. And that's really important. And it's great to see that kind of leadership and vision. I also applaud the notions that this is voluntary and free. Those two principles underlying what they're doing are spot on for what the entire industry should be thinking about from the individual citizen's perspective. Those are really important ingredients. I think, you know, as I look across the country, we're not a homogeneous nation, are we? All states are different, all regions are different points of view, different approaches, and so forth. So as I think about this problem of a citizen being able to provide a credential if they choose to, and if asked to for a given activity, it's going to vary in different locations. So I think there are heterogeneous solutions for this as well that all need to be built upon the same set of principles. There need to be an architecture that is safe and secure, and that is reliable, and where patient privacy and patient confidential health information is securely handled, and where the individual citizen has complete control over what happens with it, who sees it, and under what circumstances. So those founding principles are essential for everything, and they're present here, so that's great. But it may be that in other locations, it's the private sector that kind of leads the charge. So we're seeing with industry now, we're seeing a number of organizations which are getting ready to roll out their versions, both in the pharmacy chain industry and also in the electronic health record manufacturer industry. And release of those kinds of credentials and credentialing systems are imminent, and will provide access to this kind of capability for many, many more people across the country, in addition to those in New York State who already have that ability. And by the way, it's my understanding, and I've asked Sandra to give us the numbers, it's my understanding that with this early adoption in the state of New York, that the scale is already very large. We're talking millions of people who are taking advantage of this and have access to it at this point.
Yeah, Jay, first, I just want to thank you for your support. It is essential for thought leaders like yourself, and being behind having MITRE as your backdrop for recognizing the effort that New York has done here, and that we really have paved the way. We couldn't agree more, right? It's all about citizen control and choice. It has always been the key there for us. And that approach has been central to our conversations with our partners in this entire space. I think one of the things that, you know, typically government does not do IT projects well. So we are really pleased with our multi-state effort in this public-private partnership to bring to light such a discussion that is leading the nation and internationally. Whether you have a policy perspective or philosophical perspective, you know, in some instance, the technology has been easier than the policy discussion that this has been driving. But I would say that the policy discussion is one that it's time for the country to have, and being at the forefront of the individual option, that it's all in the hands of the individual. You know, we have at this point are nearly 2 million individuals with the Excelsior Pass. I think it's approximately 1.8 million as of this morning. And to date, we've also reached almost 200 private and public sector partners in our one-on-one discussions with getting adoption in the businesses for using Excelsior Pass, the verifier app. We also have seen a lot of organic use by individuals, ranging from people who are throwing Excelsior Pass rave parties to, you know, and it's a conversation that the adoption is actually driven more by the users and business and not government, right? After a year and a half of being at the forefront and being in COVID, we all, either individually or personally, or in our businesses, have collectively had a long road and different experiences, right? So it's about the individual's comfort level And we very much have noticed that it ranges from people are just proud that they've been vaccinated. You know, I had the fortunate opportunity to be a part of the New York State mass vaccination sites and also go to many of our sites. And that hope and promise that the vaccine and being vaccinated delivered to people who made it a choice to receive the vaccine really has been translating that energy into the use of the Excelsior Pass. I think one of the things that Jay was raising more broadly, Jason, is that this conversation is a catalyst of digital transformation in the public service delivery. And by all accounts, we have moved up the conversation by several years by being out there with the Excelsior Pass.
Jason, we also talked recently about impediments to adoption, not just of this kind of technology, but also the vaccine itself and vaccine hesitancy. And we've seen over the past several days and weeks now a number of trends. First of all, as we've talked about more than once, vaccines and vaccinations work. And so if you look at areas that have a high incidence and prevalence of vaccination, 60, 70%, those are the areas where hospitalizations are at an all-time low, death rates are plunging, and new cases per day are very, very low, as are the positivity rates for diagnostic testing at an all-time low for several months compared to recent days. These are all great and clearly indicate that the vaccine and the vaccinations are working. And that success breeds success. So people are getting more and more aware of that and also seeing the counterexamples. And we only have to look to, say, the Summer Olympics in Japan, the country that's got less than 3% vaccination right now. That whole enterprise is very much in jeopardy. Why? Because not enough people are vaccinated. We are very fortunate in this country that we do not have that circumstance. So this and this credentialing initiative of various sorts is helping to further promote that effort, which is good for the country.
We're about to hit a break, but before we do that, let me just ask you real quick. You made a very interesting conversation that the tech is easier than the policy discussion. Is that just a sign of the times, meaning we're more acceptable of cloud? We have so many people have smartphones as one avenue to demonstrate their credential, but it's the other piece that's where the big challenge has been for New York and others.
You know, Jason, anything that involves technology, and if people are not in technology, it makes people uncomfortable. Whether it's learning to use a new smartphone or it's figuring out how to download an app that you would use in your everyday life, it's just the fear of the unknown and fear of not knowing, right? This is a use case for new technology that's not always readily identifiable. And I think as we've gone through this journey of identifying the use cases, whether it's been for college reopening, businesses, etc., this has really been about implications that are much more profound and longer lasting than the Excelsior Pass itself. And I think when I talk about, and I mentioned that the policy sometimes is harder than the technology, it really is a national conversation where you can already see the state legislatures that are banning any such use. And I think if people do not have a better understanding of the intersection of privacy and security that is built into this app, then it will continue to be an uphill battle of pushing the policymakers. What we need at this time is for public sector, public health, private sector, technology, folks from all different sides to come together and really talk about what is the next generation here in a citizen's digital record, whether it's in the health space or some other area of a government program.
You open the door to a big old conversation that we're going to do in the next segment. So let's take a quick break. When we come back, we can hit upon all those things you just mentioned. You're listening to part 2 of the discussion Coronavirus, the Need for a Vaccine Credential, sponsored by MITRE on Federal News Network.